All right.
We got some medical terms.
We do.
We want to make sure we're very clear on.
And the guy with the medical clothing is going to talk more now, and I'm going to sit down and listen.
He's going to understand.
Which means
if I can get him to understand this, you guys are going to be professionals.
For real.
So the first one we mainly want to talk about is periodontal disease.
It's a primary one too, right?
It's primary. It's the number one veterinary disease, period. Wow. There's stages to this, all right? 1 through 4, but just in general, periodontal disease refers to inflammation of the teeth and its supporting bone.
Gotcha.
All right?
That's phase 1.
Phase 1 is gingivitis. Periodontal disease, stage 1 is gingivitis. This is the only reversible stage of periodontal disease. If you don't get it early, everything else is going to be progressive. Guaranteed.
Gotcha. And you know what? I know people get gingivitis as well. It's uncomfortable. So imagine your pet. They can't tell you that it has this issue and you're not looking and smiling.
And unfortunately, they will not say anything. Don't forget, cats and pit bulls are my number one liars for these kind of considerations. Still going to eat, still going to drink, do their thing, still going to love you because
still going to play.
You're their best friend. And still going to act cantankerous. And that's going to be their variation of normal. So that's why it's important, especially if you're not brushing your teeth every day, to stay on top of it. Stage 2, periodontal disease, is start where things are not becoming reversible anymore.
Irreversible.
These are, So
usually about you got it, you got it.
You got it. You got to deal with some form of treatment. If we catch it early, at least we may be able to salvage or save the tooth or teeth, depending on when we get it and how bad it's progressing, right? That's about 25% bone loss. And that's when you have root exposure. So just think about a receding hairline that gets pushed back more and more. If you don't do anything or get on whatever treatment plan for that sooner and later, you're stuck.
Got you.
All right. Stage 3, 25 to 50% bone loss, right? You see this damage is getting more and more irreversible.
Let's get some images up here.
Yeah. More and more irreversible. Okay. And now you got to deal with either complete removal of these teeth, depending on what we can maybe add some gels. It just depends on what we see. And then stage 4, they got to go. I mean, they have to go. They've been gone. More than likely, stage 3, we had to remove some teeth, but now they're reaching one and teaching many teeth around them, those neighboring teeth.
And I'm assuming that when your cat has this type of situation going on, it's then noticeable, right?
Excessively
odors.
painful.
You can probably see it if you get a look in your cat's mouth.
Yeah.
You probably it's going to have an effect on how they eat.
Yeah. Oh, for sure. I mean, again, they lie. So, I mean, I don't want to blanket statement like, hey, they don't get it or they don't show you pain until stage 4. It just depends on the cat.
But I can tell you now, you're going to get pushed back like crazy if I'm bringing my cat. You're telling me I have stage 4. You got to take the teeth. The cat's still playing and eating.
I guarantee you.
And then you tell me I'm also going to have to pay you a boatload of money to pull those teeth.
I guarantee you. I guarantee you. If you don't brush those teeth, and it's been years, this is inevitable. It's a guarantee. And that comes with all types of pain. I've never met a healthy, fun disease. Never. And these are the main ones, guys. So again, that's why we're here. You got to trust in us at some point in your life to understand, hey, we're going to provide the best care for your baby because we know what we're dealing with. This is a 15 out of 10 pain.
You know what's crazy? I'm always so impressed when you think about veterinary medicine because you guys have to cover like so many different areas. Like you're sitting here talking like a dentist.
Got to. And, a lot of my clients are dentists and their pets have periodontal disease.
Do they understand it when you tell them?
It's definitely an epiphany. Like, it's one of those moments. But again, a safe space, and they're in their own world. It's not their pain, not their problem sometimes. So, again, that's why we liaison and make sure. Hey, let me let you understand exactly what your baby is dealing with, right, and get a treatment plan that's appropriate.
And that's not the only problem you can find in a cat, right?
Oh, for sure. It gets escalated really quickly. We call this stomatitis.
Stomatitis.
So,
Sergio,
you got it. Appreciate you. So stomatitis is inflammation of the mouth, oral cavity, the mucous membranes within the mouth, sometimes the tongue, cheeks, and this is just all inflammation. So this is like your periodontal disease on steroids. Just imagine your mouth has a fire on it and kerosene got kicked in.
Oh, wow. And does this always come with the other, or can you have one and not the other?
Usually they're kind of synonymous because you're going to have some periodontal disease already in process. Can be a little complicated, but this is pretty common in these guys, especially if they've never seen a toothbrush and definitely never seen a dental procedure before. So you got to stay on top of it. Again, certain cats are a little more reactive than others, but the key is stay on top of it to avoid that. That's a very prominent issue that you want to hop on quick, and they will not eat. If that mouth is so inflamed, you waited too long, it's been too chronic of an issue, and now the pet is obviously in pain.
And there's one that's called that word you use. I don't like these big words, stomatitis. But there's another one that is this gingivitis stomatitis. Gingivo
Stomatitis.
That's just
Gingiva. Oh, and this is just stomatitis on steroids, guys. Not as common, thank goodness, because it's usually indicated by some sort of immunocompromised situation.
So you just had a double layer steroid. I'm going to make sure that you understand that and that our audience understands that, because you said gingivitis as it goes as stomatitis is gingivitis on steroid, and then you said this
gingivostomatitis is stomatitis on steroid.
Is stomatitis gingivitis on steroid? Because you said that too.
You're confusing my audience.
Confusing me.
Yeah.
But somebody's confused. That's why we have a doctor on board right here, Dr.
And sometimes he just don't know when to
call him Joe anymore.
He don't know when to do that. You know what I mean? He just don't know when to be quiet. But you know what? He reminds me of so many clients.
I'm the client.
So I appreciate that.
I'm the client. I'm the client. So this one right here we're looking at.
Everything's inflamed.
Right here.
Everything's inflamed. This mouth can't take a piece of kibble, can't take wet food. I mean, can't take anything. It's all inflamed. I mean, you're talking about you maybe have some compromised airway issues. Right, and this can also go passed down in the throat, all right, or the esophagus. So everything that compromises the oral cavity is inflamed. Yeah.
That looks real serious, Doc. And those are the main ones, right, that we'll hit off.
And those are very expensive. I mean, this either treat them fully or quality of life.
You guys use the term as quality of life is actually referring to time for death.
Humane euthanasia. There we go. So we're trying to avoid that, and if you don't know about it, can't avoid it.
And you got to keep watching, because I'm telling you, you're going to kill your cat if you don't. I don't know if I'm supposed to say it that way, but
it happens.
It does. And it's easy to avoid it.
Yeah.
There's a couple of simple steps.
We call that benign neglect.
Benign neglect. We're going to talk about benign that today. That's what we're going to do. We're going to talk about that, because we don't want you to kill your cat. That's why we got a doctor. Right?
Thanks, Aunt. I appreciate you.
Okay.
Every day.
We got it.